We're prepared to handle it.
Dr. Dean Seidlinger is Oregon's state health officer and epidemiologist. He and his team are working around the clock, fielding possible COVID-19 patients and figuring out who needs to be tested. The state's following the CDC's guidelines to decide who to test. Patients who fall under one of three categories: people who've traveled to a country where COVID-19 is spreading rapidly, people showing symptoms and have had contact with someone diagnosed with COVID-19, or people hospitalized with severe respiratory symptoms and ruled out for other illnesses like the flu. So far, 3 people in Oregon have tested positive for COVID-19. Those samples were shipped to CDC headquarters for another test to confirm.
We assume that these tests that are positive here in Oregon are going to be positive at the Centers for Disease Control and Prevention, but until we get that confirmatory test, we do call it a presumptive test here in Oregon.
Oregon has enough emergency test kits from the CDC to test up to 80 people a day and material for 1,500 tests. State health officials are training more staff to administer the test to meet what they're expecting to be a growing demand.
We're going to identify more people who have symptoms and would need to be tested for COVID-19. I can't predict the exact amount, but as the disease appears to be spreading in the community, we do anticipate that the request for tests will continue to increase.
Seidlinger believes the vast majority of people who get COVID-19 will have mild symptoms and may never know they have it. That makes things tricky since they could still pose a risk to others, particularly older people and those with underlying medical conditions.
Just because someone may have mild symptoms, if they come in contact with someone in a high-risk group, that person is still at higher risk for developing complications. And that's why some of the simple steps that we've used for centuries are what we continue to recommend with this infection, because they work.
And once again, those steps being stay home until you're better, cover your mouth when you sneeze or cough, don't touch your nose or mouth, and wash hands frequently. We can't share those steps enough. The state is expecting confirmed test results from the CDC on Oregon's 3 COVID-19 patients very soon, possibly tomorrow.